Okay, good morning, everybody. Welcome to our webinar on COVID-19 and technology. My name is John Holland. I'm the Chief Development Officer of Pinchin, and I'm calling in from Richmond, BC. This is the fifth of our series on mitigating and managing the impacts of COVID-19 in buildings, and we're going to continue presenting these as we learn new things and share those learnings with our community. We're presenting this to the broader community so that our knowledge is shared, and we hope to share our findings with all of you so that we safely and diligently occupy our buildings in the COVID period and beyond, for that matter. As we're all very likely aware, COVID-19 has changed our perception of buildings and our ideas around safety as we occupy them. We reduced occupancy in the last 6 months and in some cases evacuated our shared spaces. Our schools and healthcare buildings, we're occupying them with more controls and many more restrictions. And the sudden emergence of a highly infectious virus has challenged all of us to find normality while respecting and managing the risks of infection. In previous times, I've been reading a fair bit about this. We've had to adapt buildings and infrastructure to mitigate against health issues. Haussmann's 1800s renovation of Paris in response to widespread disease. And then the mid-century modernists of the 1950s, like Le Corbusier and Walter Gropius, who created clean and simple buildings in the mid-century in response to the TB pandemic of the, or epidemics of the early 1930s. So we're on a journey of making our workspace and the places we live and the places we go to school and we go for healthcare safer in the light of an emerging health situation. And so this webinar is a result of our emerging knowledge through advising our clients on safe and managed re-occupancy, combined with our emerging use of technology to manage, control, and mitigate building parameters to optimize our safe occupancy. It's our hope and belief that the collection and analysis of real-time data in buildings will help us mitigate the impact of this pandemic, but also better prepare us for the future. So after this presentation's over, we'll be making this available on our webpage for people to look at in the coming days, people that couldn't make it today. And at the end of the presentation, don't sign off, we have about an hour. If you could, we have a feedback screen that we'd like your feedback on. And we use that feedback both to improve our presentations, make them more relevant to all of you, and to structure and create future presentations which help inform all of us about this emerging issue and emerging trends in managing it. Next slide, please. And a few housekeeping notes. So please get comfortable, obviously. Adjust the audio volume so you can hear us. I'm sure you've done that already. There are a few features on the screen. The chat screen, we're asking you to use just for technology issues. If you can't hear us or can't see or you can't be heard on a question, please put it there. If you have a question on the presentation, use the Q&A function there, please, for that. And just as a volume check before we get started, could you all raise your hands so we can see that we're being heard? Always helps in webinars. Next slide, please. So we have two presenters today, both Ryan Hickey and David Shearer. I'll start with David. David is the Director of Integrated Digital Services at Pinchin. He also manages our Kelowna, BC office near me, where we had to deal with the forest fire smoke recently on the indoor air quality issue. Dave was previously the National Practice Leader of Indoor Environmental Quality for Pinchin West, before we merged with Pinchin 3 years ago. He's worked on a diverse array of specialist projects in that role, including responses to national disasters, including their health impacts, including the Bow River floods, Slave Lake fires, Fort McMurray fires, and the Okanagan Valley fires. He's very much engaged in emerging issues around the application of technology in indoor air quality. Our second speaker is Ryan Hickey. Ryan Hickey with 11X has 20 years of leadership experience in the telecommunications industry, including the most recent 15 years in a senior engineering role in a global telecom success, BlackBerry. While at BlackBerry, Ryan oversaw the development and low power and highly reliable wireless technology for the company's smartphone devices. Ryan has several wireless and embedded system patents to his name and is currently a LoRaWAN ambassador for the LoRa Alliance. He received his Bachelor of Engineering in Electronic Engineering from Dalhousie University, and he's also a professional engineer. So with that, I'd like to thank you all for attending, encourage you to ask questions and participate, and we'll loop back at the end with your questions. Over to you. Thank you very much.
Thanks, John. Good morning to everyone in the West and good afternoon to everyone in the East. I've had the privilege of working with Ryan from 11X for about a year now, and more formally in the last couple of months because we've formed a partnership working on deploying smart building technology in buildings. 11X are experts in networks and sensors, and that pairs up very well with Pinchin's expertise in indoor environments. And today we're here to present on that solution and other solutions around it, and help further develop ideas around how to use technology to support managing COVID risk. So I've spent the last 6 months talking to clients, understanding what their challenges are related to COVID, working through those challenges, figuring out how to get them back in their space, how to make their space functional. And the themes that come out of those discussions are fairly common. Tenant retention, or keeping occupants in buildings, is a big problem for people that own and manage buildings right now. If a lease is coming up for a tenant and it's for the next couple of years, they have a hard decision to make about how much physical space they need to take on for their operation. So that causes leasing challenges. And definitely figuring out how to keep people in spaces is important to maintaining that occupancy. The occupant experience is something that is increasingly challenging to manage. We've all gotten, those of us who have been working from home, as I am right now, have gotten pretty comfortable doing that. And it's very safe. At home, I think everyone feels like they're in an environment that they're not affected by COVID, at least. For the most part, when they start venturing out to go for groceries or go into the office, that risk changes. Human nature is that we're not very good at evaluating occupant risk or health risks and kind of characterizing them. So it's an uncomfortable decision for some people to make, to go into the office. So trying to find ways to break that down and provide some reassurances about the office or the indoor environments is critical. OHS due diligence. The COVID requirements are changing constantly, maybe not as much as they were in March and April, but every time that new research is submitted, little things change in the policy, or when community outbreaks start to increase, little things change in policy. So it's hard to develop a plan in that sort of circumstances. So having a data-driven approach to that is very beneficial to monitor the effectiveness of what you're doing, help make better decisions. EHS managers have a lot to do in their roles as it is, and adding COVID-19 into that mix is overwhelming. Next slide, please. This is just a basic summary of how COVID is managed in buildings based on our experiences over the last handful of months. Typically, the process starts out with a risk assessment. So looking at the building, looking at how the occupants interact with that space, certain risk factors like population risk. There are certain cohorts of individuals that are elderly or immune compromised that present specific challenges in managing COVID. Doing some re-occupancy planning, looking at your space and figuring out how you can adapt it to meet the current public health requirements. HVAC optimization, so looking at your ventilation system and figuring out how to configure it in such a way to minimize the potential risk of airborne spread. Space planning, so this is a substantial component of reviewing your seating plans in your office environment or in your indoor environment and figuring out how many people you can get in there and still meet that 2-meter physical distancing requirements. Where in the building are there specific challenges, elevators, lunchrooms, washrooms, spaces that are shared that require specific kind of planning to get that to work. And then after you've done all these things, how do you know that they're actually having the desired impact? How do you know that people are following the occupancy plan? How do you know that the HVAC system is functioning as well as it possibly can? And we propose that using IoT or Internet of Things or smart building sensors can provide some visibility to this that's beneficial in both demonstrating diligence and keeping the plan updated and identifying where you may be having some challenges. Next slide, please. So post-COVID risk mitigation in buildings. I already spoke about this risk assessment concept, but this was actually introduced in Ontario early on with respect to workplaces and figuring out what risk factors need to be considered prior to reoccupancy. And taking into that risk mitigation model the potential for airborne transmission. There's been lots of discussion around this. ASHRAE has come out and said that essentially it's likely or plausible that airborne transmission is possible. I'm not sure how closely any of you follow the CDC updates in the last week, but there's been a flip-flop on this. It was on again, off again, on again. In that kind of a situation, I think we can all just, take the position of lowest risk and recognize that airborne spread is a real thing and that we need to adapt our buildings to represent that. And we really need data-driven metrics to evaluate that these measures are working, that we have the desired impact. Next slide, please. So I've been doing indoor air quality work for 20 years. And the device that you see on the left here is an integrated indoor air quality monitoring device. It senses a handful of parameters: temperature, relative humidity, CO2, CO, and PM, particulate matter. And there's a little screen on it, and you can get spot measurements with it, or you can deploy this in the field, which involves dropping it off at a site, setting it up properly, letting it data log for up to a week, and then bringing it back to the office and downloading that data. That's a time-consuming process. We do a fair bit of proactive indoor air quality work for our clients, and that involves going into their buildings and using a device like this to take spot measurements through a building, maybe taking some data logging samples in a few locations. But the real-time sensors have reached a point where by the time you've done spot measurements in a building about 4 times, you're approaching the same kind of cost as deploying a real-time sensor network, which is kind of, I think, is a clear trend on where indoor air quality is going. So the measurements from these real-time devices that you see at the bottom left, collected continuously, can be stored in a data management portal. Pinchin has developed a portal called Pinchin Core that our clients can log into and see the results from all of these sensors. Notifications can be sent if certain indoor air quality criteria are outside parameter, so that stakeholders, facility management staff can be aware of potential indoor air quality problems as they occur, allowing for a far more proactive approach to managing indoor air quality in buildings. Next slide, please. So within the indoor air quality monitoring, there's 3 parameters that we consider to be significant to managing COVID-19 risk. The first one is carbon dioxide. So as each of us are sitting at our desk in front of a computer screen today, we're breathing in oxygen and exhaling carbon dioxide. That carbon dioxide is a direct indication of occupant loading and ventilation effectiveness. Essentially, the ventilation balance should be such that the carbon dioxide is diluted out or ventilated out as quickly as it's provided by the occupants. So if we can measure CO2, we can figure out how many people are in the building, and we're typically in indoor air quality work, the criteria for CO2 is around 1,200. For COVID risk management, if we can keep that number below 800, I think we're demonstrating that we've got good ventilation and that our space planning is working and that we don't have high occupant densities. So we don't have and in all likelihood, then that also means that the 2-meter physical distancing is also being observed. Next slide, please. Relative humidity is another parameter of significance around COVID. So if we can maintain relative humidity between 40 and 60%, it has a combined effect. So essentially, the virus nuclei are less likely to form at this relative humidity range. So as we exhale or release respiratory droplets while we speak, those droplets are less likely to dry up and release a virus nuclei. Also in this 40 to 60% range, our lung tissues are more resistant to viruses. So in the event that we are exposed to a virus, if we're in this range, our lungs are more resilient. We're less likely to get infected. Next slide, please. And the third one being filtration effectiveness. So we know that the COVID virus nuclei, or the SARS-CoV-2 virus nuclei, is around PM3, so 3 microns. And we can measure using indoor air quality devices PM 2.5. So they're close enough that it shows very strong relationship that we have a filtration system that is effective at removing particles of the same size as the virus. So if we have good filtration in a building and we're measuring low PM 2.5 numbers, that very strongly demonstrates that we have good filtration and are minimizing the risk of airborne transmission. Next slide, please. So here's an example of a slide or a graph from our data management system showing CO2. And the graph in the middle. So essentially, I believe August 16th and 17th were a weekend, so there was no occupancy in the building, and we see CO2 kind of at a steady state of around 450, which is basically what we measure outside. And then you can see that early in the morning on the 17th, some occupants came into the building, specifically into our office. It looks like they were working there for 3 or 4 hours. Then they went for lunch. That's when you see that first drop in CO2 concentrations. And then they came back after lunch. And then it looks like maybe there was a bit higher occupancy in the afternoon. And then towards the end of the day, everyone left and the CO2 concentration drops down to that baseline level. And then the next day, it came back up, went down at lunch, and then it came back higher, but not as high as it was lunch on the first day. So from what I observed and what we correlated to this, on the 17th, we had 1 person in the office in the morning and 2 people in the afternoon. And on the 18th, we had 1 person in the morning and 1 person in the afternoon. So that's how the signature from CO2 can demonstrate occupancy patterns. Next slide, please. Here is some data from last week in British Columbia. So for those of you that are calling in from other areas of Canada, we had a significant wildfire event occur. Basically, smoke was being transported from California, Oregon, and Washington up into BC, parts of Alberta. I think it even made its way as far as Toronto. Maybe not the same kind of ambient impact, but you could see smoke in Toronto from fires in Western North America. And what we could see in our offices is massive spikes in particulate concentrations. So you can see that there was a significant event that occurred on the 11th, and it was most pronounced in the southern Okanagan region, where I'm located. So that bright green line being the Kelowna office. And then those conditions abated through the 19th. And then after that, following the 21st, things kind of dropped back down to normal. So this is really our buildings talking to us. This is us getting information that's specific to how occupant experience will be affected, what the air quality is like in the space. And when you have this kind of knowledge, you can put countermeasures in place, introduce air scrubbers. You can start to develop a plan to bring the air quality back within reasonable parameters. So this tool is very powerful in being able to see what is happening in buildings. Next slide, please. So we frequently get questions from clients asking, "Hey, Dave, can you sample our air for the SARS-CoV-2 virus? So can we identify the virus in air?" So there are some sensors or sensing technology that's out there that may be able to do this in the future. Right now, it's not as reliable as it could be. There are definitely analytical techniques that you could use to do this. You could take an air sample and ship it off to the lab. And I think what we want to reinforce is that we don't expect to find the SARS-CoV-2 virus in the indoor environment. So sampling for it is not an effective way of evaluating COVID risk in a building. You really need to focus on kind of making sure that you've implemented your management plan effectively, that you're cleaning surfaces effectively, and that you've got really good ventilation. It's all about how strong of a defense have you built, not about whether or not the SARS-CoV-2 virus has somehow made it into your building. So there's limited application for this. Maybe in the cases of re-occupancy, you might consider doing this, but I don't see this being something that is going to be kind of a good tool in the future. So next slide, please.
Okay, I guess it's my turn. Hi again, this is Ryan Hickey from 11X, and Dave, thanks for the little intro there. I also enjoy working with you guys, and I want to thank Pinchin for inviting us to partake in this, and also thank everyone on the line that's joined. I know you're all very busy, so I hope you get something out of this. Looking forward to questions and stuff later, but let me tell you a little bit about kind of 11X really briefly. So as Dave said, our specialty is really what we call the Internet of Things. So that requires, you know, quite a few elements to make a system work. I'm gonna go through that in a little more detail on the next slides. But I just want to do a little intro to the Internet of Things, or IoT. It's a bit of a buzzword. Not everybody on the line may know what it is. A good analogy that we all can relate to, or at least a lot of us, is if you have a Nest thermostat. So think about that before, when it was not connected to the internet. You know, you go and you set it manually. But now that it's connected to the internet, you can do a lot more with it. You can set it on your temperature on your smartphone. You can look at historical temperatures. You got the cloud analytics kicking in to predict, you know, when it should turn on the heat to get it to the right temperature. That's really a great example of Internet of Things. It's really about connecting something that maybe previously wasn't connected before to the internet, so that you can do a whole bunch of more things with it. You can collect data, you can make decisions on that data, you can do more advanced things, more advanced analytics, visualizations, and all that good stuff. So let me go into that just a little bit deeper. Can you go to the next slide, please, Kaylee? So the Internet of Things, the way that we describe it, is it's made up of 3 technology layers: the device, the network, and the application, which we call the DNA of IoT. So on this slide, I'll talk to you a little bit about the device. So when we say device, we really mean like a sensor like this one. It could be anything. It could be a water meter or anything like that. Something that is now connected to the internet, and we're collecting data and potentially controlling. This particular device we use in the solution that we're talking about previously. What's really, really interesting here is this was not even possible a few years ago, to be able to have this very small, lightweight, low-cost sensor that can accurately and reliably measure all of these types of measurements. So you have CO2, relative humidity, temperature, and also it measures light and motion, all in one sensor. It can last up to 10 years on the battery, and it's continuously reporting into the internet over the LoRaWAN network, and it's totally secure. So there's been a lot of technological advancements with basically chips, microchips, and sensor technology that can really allow this to happen. Next slide, please. So the other layer I mentioned, so the first one, devices, the next one, network connectivity. So there's been a lot of advancements in this area as well in the recent years. We're all familiar with cellular. Of course, that connects to our phones. Bluetooth, you know, very short range, can connect to our car and stuff like that, headsets. And then Wi-Fi is pretty short range, but really great for our phones and other tablets and whatnot to get connected to the internet. But there's this other sector that's just emerging in the last few years called LPWAN, or low power wide area networking. And the dominant technology there is LoRaWAN, which is what we use for the solution we're talking about today. And really it really enables these battery operated devices that can be deployed throughout the environment, whether it be in building or outside, because it has long range, and it's designed for like low bit rates, so infrequent transmissions with a little bit of data, which is perfect for these types of air quality sensors. And again, it's been built from the ground up to really address that low power battery operated type of sensor. Next slide, please. And then the other layer, the final layer that I'm going to talk about today is the application layer. So there's been huge developments in the application layer in recent years with the ability to do visualizations on data, the ability to do analytics, machine learning, artificial intelligence. All of these technology advancements has made basically the ability for us to derive a lot of value from that data. It's one thing to collect the data, it's one thing to take an accurate measurement and then collect it over a LoRaWAN network and store it somewhere. It's a completely different value proposition when you're able to make intelligent decisions based on that data. So that's really what this application layer is all about. And of course, with respect to COVID, there's COVID risk management. There's kind of some special attributes I want to point out. You know, as things change, like Dave mentioned, you know, CDC on again, off again on the air quality thing, and you know, temperature, people's body temperature was a big thing at the beginning as well. We're still learning. The virus has only been around for 10 months now. So to be able to look at data, make decisions, make adjustments, and then go back and see how that's affected things is super important during this time, as well as being able to get, you know, reports, as well as alerts to understand, you know, if there's an issue in real time, I'm going to get an alert to be notified and take some action on that. Next slide, please. So all these three components put together provide a solution. And really, because of these technological advancements in the last years, 3-4 years, you're able to realize all this value at a cost-effective price point. Some other advantages, just to summarize here, the devices, again, because they're battery operated and they're wirelessly connected, they're super easy to install and require almost no maintenance and last for many, many years. The network, as I mentioned, a little bit more about LoRaWAN, I'd like to point out is it's an open standard, it's a global ecosystem. There's some really big players that are part of the LoRa Alliance, which is the governing body of the standard itself. Big names like Google, Microsoft, IBM, Cisco, Amazon, and many, many others are members of this alliance, including 11X. We've been a member for quite a few years now. And this really enables that collection of the data. And then finally, the cloud-based solutions have become a lot more affordable. Just to point out, if you're not familiar with what I mean by cloud-based solutions, essentially, you know, the entire application is hosted by the provider of the service and the solution. So you really just get a username and password. You can log in to through a phone app or on the web, and you don't need any local IT in any of the buildings. And it also offers a great way to spread the cost of the solution across CapEx and OpEx because it's a subscription-based model. Go to the next slide, please. So we talked a lot about, you know, air quality and how that's a great way to fight the spread of COVID. But I want to point out some other solutions that you may or may not be aware of. So this one, people counting, is really, really useful to understand the number of people going in and out of a particular space. The best example I can think of that we can all relate to is going into Canadian Tire or another store, Walmart, whatever, and then you have to wait outside in a line because the capacity of the store has been exceeded, the safe capacity, I should say. So, you know, when you get to the head of that line, you'll most likely see someone standing there with a clicker. So by clicker, I just mean a counter. You click one side for adding counts, and you click another side for subtracting counts. And I don't know how many people are employed out there today just clicking the clickers. This could provide an automated way to do that. I'm sure those people with the clickers have better things to do, like customer service and stocking shelves and all kinds of good things. So this is really a way to automate that. You could connect this count system back to other connected Internet of Things devices, like a display that could give you the counts that are inside at the current moment, and whether or not they're exceeded the safety level or not. Or you could just have a light that's green for enter or red to wait, continue to wait in a line. There's all kinds of things that can be enabled with something like this. Next slide, please. Proximity detection. So this one, really, proximity detection is simply understanding the distance between two sensors. So if you were to put sensors on people, and the sensors are continuously monitoring distance from other sensors, so if everyone's wearing a sensor, that's great. You can determine if they're practicing social distancing, as well as you can trace who's come in contact with other people. Contact tracing is obviously a very important method of trying to contain the virus. So as you can see, that would be a super interesting type of sensor and solution to have. Just a couple more notes. These are battery operated. They'll last a week to 2 weeks, and people can wear them to help with that. Okay, next slide, please. Another really interesting one is what we call occupancy detection. So Dave had mentioned about people being in certain spaces. With occupancy detection, you can determine whether a person is in a room or shared space, or even down to the desk level resolution, if you like. So some policies that could be in place is a meeting should be no more than 45 minutes, so you can actually audit that to make sure the room gets vacated for 15 minutes in between each meeting, things like that. And then also for the desk occupancy, the sensor on the bottom is very, again, it's many years of battery, very easy to install, wirelessly connected, can be installed at every single desk, and then it can detect whether or not the desk is occupied. This is great for managing spaces, shared spaces. I think there's already a big trend to have shared cubicle spaces for many years now. I think in the face of post-COVID or even during COVID, that's going to be probably accelerated with the flexibility that'll probably be provided for a long time for working from home and other arrangements. So what this provides is, is a desk occupied or not? Can it be booked or not? So again, this is connected to a web application, which could simply say, green if it's vacant, red if it's occupied, and maybe yellow if it's been occupied but not cleaned. The nice thing about this sensor is there's actually a button on it. So, a facilities person or a cleaning person could monitor the situation. When they've cleaned the space, they can press the button, and then it'll update the web application and the phone application to make that green space again. Next slide, please. I mentioned this a little bit earlier. This is really about detecting body temperature using infrared. This picture is showing a completely touchless system that obviously is connected to the internet as well. So it's a great way to monitor the temperature of people coming into a space. If the temperature is exceeding a certain limit, they could send an alert and notifying people that maybe this person shouldn't enter or whatever. Next one. The other thing I want to mention is once you have this type of smart building technology deployed in a building, it's very extensible to many other types of applications. A really interesting one is leak detection. That's obviously, leaks are a huge problem for any building. Now with COVID, when the buildings aren't as occupied as perhaps they were in the past, it could mean that a leak can go undetected, which could be a big problem. So leak detection is something that sensor, like one of the ones you see here on the top left, that sensor can be used, it can be deployed in all kinds of areas that are higher risk to having leaks. Other applications that are super relevant to helping with building operations and energy monitoring and all kinds of stuff are listed here. I'll go a little bit deeper into a couple. Bathroom maintenance, that's a little bit relevant, as well as cleanliness is a big issue with COVID-19. So being able to monitor how much a bathroom is being used. You can also have soap dispenser monitor sensors, as well as paper towel monitoring sensors and things like that, or even a push button to say, this bathroom is a little dirty, can someone come clean it? All these elements are super important to help with the operations and keep the place as clean as possible. Security, every building has little nooks and crannies that maybe aren't being monitored by the current system. We've had a situation where a customer wanted to monitor a couple doors at their condo to see if they've been opened or not, to help with the homeless problem, people getting in the building and stuff. Parking is another great one. So again, just parking is something we all can relate to, and currently parking spaces are not connected to the internet, but by adding parking sensors, you can help with that. This becomes increasingly important with, you know, how transportation is going to be affected by COVID, whether it be in your building or your parking lot, or even generally speaking. You know, are people going to use public transit? Are they going to use ride share? Is there going to be a bigger need for pickup drop off? All kinds of things like this are going to be constantly changing, and be able to understand how these parking assets are being used can help with future planning, as well as just people's general safety. Next slide. So what can we do with all this data? As I mentioned earlier, you know, the Internet of Things is not really about the things. It's not really about the sensors themselves. It's about the ability to collect data from the sensors and then realize real value from those sensors. So here I've listed the indoor air quality sensor type or use case. It can really help with decisions related to your HVAC settings or other office policies. I think what's really interesting to me is that, you know, you may implement a new setting or new policy, and instead of that being a Hail Mary, you can actually go and monitor how that has affected things. You know, is it really improving things? And if not, maybe you adjust things a little bit different. Maybe you just need to have a little bit of enforcement. Maybe you're under, like every Wednesday afternoon, like I think it was Wednesday that Dave presented, you know, the CO2 rose above a certain level. If that's above the, you know, minimum level or the maximum safety level, then maybe you should just have someone walk around there to see what's going on. And if the people if there's too many people in a meeting room or whatever, maybe you just need to tap them and say, hey guys, remember the policy? So it's not always a big, expensive HVAC upgrade is one thing to state. And also you may not get it right the first time when you make an adjustment. So it's great to have that continuous monitoring and continuous learning. People counting, I think I went through this pretty detailed before. Essentially, it allows you to, first of all, understand if the safety limits are being reached or exceeded. It does that autonomously. There's no room for, you know, human error, as well as it can be completely automated and fed back to provide an automated entry system with light or signage of some sort that's also connected to the internet. Proximity detection, again, really help with that social distancing. Understanding if people are actually social distancing and also who people have come in contact with. Next slide, please. Occupancy detection. Talked a lot about this already, but as you can see here, when you have that system in place, you can kind of enhance your visibility into how your office space is being occupied. You can measure CO2 levels, and you can see that, yeah, this is being exceeded. There's a high density of people here. And this gives you even finer resolution. And well, I know that these 10 desks are occupied, and I know that this meeting room is occupied. And it can help not only with the COVID fight, but also longer term, understanding how to plan your space, understanding how to help people get to unoccupied desks efficiently, things like that. Body temperature, again, just understanding, does this person have a fever? And then have that, you know, overlaid on top of a policy of what you do if someone has a fever or high temperature. And leak detection. So again, leak detection is always a problem in buildings. There's a number of ways to detect that through consumption, but also through sensors that can detect water where water shouldn't be. And again, because of the mostly either unoccupied or reduced occupancy state of a lot of sites, this risk has actually gone way up. So these types of sensors can be a big help. Thank you.
Thanks, Ryan. I wanted to speak a little bit to how do these sensors help you manage risk. And this is really like having an expert in your building 24/7, 365. So the full-time monitoring, we're getting data back constantly, which means that it's kind of like always having an eye on your building. The data analytics, so what we're able to do with that data through graphing and notifications means that in real time and proactively, conditions can be evaluated in a building. Reporting, so developing customized self-serve reports. So in the instance of an occupant expressing concern about the IAQ, indoor air quality in a particular space, it's possible to generate a report for the whole building, for the floor, or perhaps for the sensor that's closest to that concerned occupant, and give them some degree of comfort in knowing that the indoor air quality is being monitored and that conditions are suitable. We've also looked at dashboarding these sorts of things and having kind of monitors in conspicuous areas that demonstrate the current indoor air quality conditions. Ryan and I were talking a little bit about this yesterday, but in 2020, people maybe are more concerned about indoor conditions than they are with the weather. So next time we're around the water cooler, maybe talking about the indoor air quality will be what the topic is. Targeted follow-up. So if you can identify where specific challenges are occurring in your space, you can address those head on and look at them specifically and adapt policies specifically, and really have a targeted response to a specific problem. In validation, you can kind of have the comfort in knowing that the modifications you've made to your buildings are resulting in favorable conditions that help support risk management, and that those spaces are suitable and safe for occupancy. Next slide, please. So in conclusion, I think that the main points that we'd like to share today is that the Internet of Things is ready. We're in a unique place where the network and the sensors are better than ever and work well in buildings. And the deployment of those sensors is easier than ever. It's not a full-on wiring project. It's simply install some batteries, remove the adhesive backer from the sensor and apply it to a surface. That's a massive shift. COVID uncertainty. The requirements are constantly changing. And having a good data set and being able to conduct experiments with respect to building performance are going to be important to decision making and remaining agile and attempting to get to the highest possible occupancy of buildings so that buildings continue to offer a degree of functionality. IQ is trending, so I think indoor environments are changed forever. The type of cleaning that we're currently doing in buildings is something that maybe only the healthcare setting contemplated before. I think realistically that's going to continue post-COVID. I think interest in having safe indoor environments, having indoor environments that inspire wellness is going to be important. Occupants are going to have higher expectations of buildings after all this is over. Extensibility, the technology that you deploy today to support kind of monitoring and managing COVID risk factors kind of opens up an enormous ecosystem that can be used in the future. So smart buildings is a growing trend, and I think all buildings will have sensors of this type in the future, and it adds value to building operations. Any questions at this point?
Yes, there are, Dave. There's a couple. One, a general question, I think probably for you. How many locations would you recommend in a typical office building? I think it's would it be required in each office? So I think we're talking a multi-tenant office building with offices rather than open plan. I think that's the concept.
Sure. So that's going to really depend on what you're trying to accomplish. But what I will say from a general IAQ perspective, a reasonable sensor density is probably in the order of one of these CO2 temperature and RH sensors per 2,500 square feet. And then, so that's basically to capture the spatial changes in ventilation and occupancy. You could certainly deploy more of them. If you wanted specific office dynamics. From experience, kind of private offices are easy to manage COVID risk around, and multi-desk areas or cubicle areas where there's higher density of occupants are more challenging. So I might consider deploying them more in those locations. And then to deploy particulate sensors on a one per floor basis or one per 10,000 square feet basis is probably adequate for demonstrating that your filtration is effective. So it depends on the type of sensor, it depends on the occupant density, but those are some kind of general rules of thumb on what we think a good strategy is.
Thank you. Okay, a general question I'll answer because two people have asked it. Will the presentation be available afterwards? Yes, it will. It'll be on our website in a few days. So stay tuned to that and you'll be able to observe the presentation then. Another question on kind of, we're all aspiring for diligence in this. This is why we're all here. We're in a uncharted territory, you know, a new virus, a new health risk in buildings that weren't designed to mitigate that. And we're doing things progressively, like doing more sampling, doing more cleaning, controlling occupancy to maximize that. Dave, you've gone down the route of real-time sensing for the last few months as part of this exercise we're doing. What have been the surprises you've learned from that process? What surprised you about having real-time data versus, I don't know, once a year, once every 3 months?
I think, and John, I've probably been looking at real-time sensors like this for a couple of years and had them in my living room for longer than that. I think, I think it surprises me how quickly conditions change. It surprises me how responsive the sensors are. How quickly CO2 concentrations increase when you have two people in close proximity to a sensor. I guess I'm impressed with how good the technology is, considering where we were a few years ago, and the insights that we can get from that. So I don't know what it is, but anytime that you can take something that you can't see and put it on a graph, I think it brings relevance and understanding, and that's really important.
Yeah, I mean, a big surprise for me, and I think you'd echo this, was when we had the forest fires this time round. We were, well, last two times we'd had the sensors, and it's been surprising, incredibly surprising, how quickly the indoor levels rise in response to outdoor levels, and how much they rise. And that's been a surprise, certainly to me, watching this process. I watch that real time every day during the forest fires. Yeah,
sensors are very responsive.
Yeah. Another question, and it's I'm gonna shade it a little bit regarding, you know, we've been in this pandemic for 6 months, or maybe even longer now, and we are dealing with the basic advice that government can give us because it's what they know. You wash your hands, you keep social distance, you stay home if you're sick, you wear masks indoors. As we get better at understanding this, government will give us more specific guidelines. Do you think it's possible that we'll get kind of health algorithms, and will this data be useful for that? You know, your building's safe if you have the following relative humidity, the relative temperature, the following CO2. Is that possible that government will give us more specific guidance on how we can occupy safely?
It's possible. I feel like it may come more from the research community than it does from the government specifically. But I've seen some in general air quality work developing indexes based on multi-factor. So you install sensors for 4 or 5 parameters, and out of that you get an index that represents how satisfied people are in the space, or should be satisfied in the space. I think we can see that those models could be adapted to provide some sort of index related to the kind of risk of transmission in a space. So I don't think sensors are the be all and end all of that. I think they're there to validate that everything's working, but certainly I think there's a way to build up all of this data into kind of a singular metric that is helpful.
Okay, good. I mean, one thing we've learned, I think, from the internet age is that people like to know about what health numbers are. They read, they want answers. And if you give them information that's real time, that's more than they know, that elucidates and enlightens, that enhances your worker tenant confidence, I'd say. And that's something that this would add. You know, you had daily readings 2 years ago. Now you have real-time readings. That's comforting. The fact that we're doing things, or the building owner is doing things to educate the employees or the occupants on the safety of their space. A broader question here, maybe for you again, Dave. Sorry, they're all technical questions rather than on the process. What about other technologies being promoted, i.e. UV and ionization? Yeah,
so again, I will not purport myself to be an expert in these technologies, and I know that ASHRAE has come out and made some statements about this. I think at this time, UV is supported by ASHRAE as a technology to help with filtration. And bipolar ionization, I'm not sure that there's as clear of support in research or ASHRAE that it's a beneficial technology, but certainly the companies that sell that technology have been very aggressively out in the market trying to sign contracts for installing it. So I can't speak to its effectiveness, but I know there's some debate about when it should be deployed.
Okay. Okay, I think that's it for the questions. So with that, I think I will close the session. We said we keep it to an hour. We're a bit ahead of that. Thank you for attending, everybody. Thank you above all to my presenters, Ryan and Dave, and to the people in the back that you haven't seen, Kaylee and Rui, who put this together. And thank you to all of you for attending. We want to keep presenting our lessons to our community. So your part in giving us feedback and attending and advising us through the questionnaire that'll come on the screen in a few minutes, what you'd like to see in the future, will help us share what we do with you more effectively and help us get through this process more quickly and hopefully more painlessly. We thank you all for attending. Have a good, safe day, and we'll see you all next time. Thanks, everybody.
Thanks, John. Thanks,
Thank
Ryan.
you.
Thanks, everyone.
Thanks, everyone.